really three main types of data that I want to just identify if I can, and there's some subcategories of data that come into this. Because in many ways, we started out thinking that 211 was a phone number, and then over time we've realized we're actually in the information business. The internet is just a delivery channel. But what underlies all this is information. So the service records, those 56,000 standardized records of service are the kind of bedrock of service delivery for us. And we rely on a community collaborative of about 30 organizations that help us bring that together. So that in classic kind of call center lingo is called the knowledge layer. And so that's key. And Harvey's going to talk about the way in which the city has used that data for a lot of different purposes and some really interesting and creative ways. But then in the delivery of service, we end up with a whole pile of information as a result of doing that. So we generally refer to that as the transaction data, and in business this is usually referred to as business intelligence. But we learn a whole lot as we get a lot of callers coming through our gates, and last year was just about 550,000 calls. This year we'll be up to nearly 700,000 calls. But as you get those calls and you track why people called, who they are, where they're from, where we sent them, how they got to us, all those kinds of things, you begin to get some really interesting information. You certainly begin to identify gaps. That's fairly easy right off the top. If you can't find the service that they need, you can identify gaps. But you also begin to get some need and demand information, seat of the pants need and demand information that can increasingly be quantified in interesting ways and can help all of us as we begin to look at the way in which services are delivered, and can be, in some cases, sobering. Just put my United Way hat back on. As a funder, sometimes it is sobering. We think we know what we're doing in terms of delivering services, and sometimes when you actually look at the data, you find that, gee, the movement has gone on, and we haven't been as quick as we need to be in terms of responding to need. And again, I'll just use a housing example. When I worked at the Federation of Metro Tenants many years ago, I can't ever recall getting a call from someone who had a utility assistance problem, as we would now refer to it, and was at risk of being evicted. Wasn't the case. Mostly at that point in time, utilities were included in the rent. Now, that is one of the chief calls that you get, and one of the chief reasons that people find themselves evicted and homeless is utility assistance. So, identifying those kinds of things early allows us to look at what you can put in place to ensure that you're meeting those changing and emerging needs, and they're always changing. So transaction data is incredibly important from the call side, but it's also interesting from the internet side. We don't get the same kind of demographics unless we survey, and surveys are always a sample, so you don't really end up with the same quality of data. But you do get some interesting real-time data. You can certainly find out what people have accessed in terms of the resources. And you do end up with some really interesting things that Kelly will illustrate, particularly on the social media side. And then there's the post-transaction data that you can also accumulate. What happened to the client after you gave them the information? Were they successful in finding what they needed? How effective were those services in meeting their needs? And for us, it helps certainly us know about client satisfaction, how people found us, and what their behavior was after they got the referral. So let me just show you very quickly a little bit of that data, and so kind of at a macro level, why do people call? Health, number one reason. You won't be able to see the little bits underneath, but basic needs is what you'll see are the key drivers of 211. We categorize calls in 20 different ways at the highest level, and then let me dig under that. So, but you can look at that on a provincial basis, but sometimes that top end story doesn't actually tell you what's happening at the community level. So just breaking it down a little bit more, you can see for Ontario, health, yeah, same as in Toronto, York, and Durham, but then underneath that, it changes. All of a sudden, you see income and financial assistance at the top for Toronto and York and Durham. Housing, right up there. Housing doesn't even appear within the rest of Ontario in our top 5. So you begin to see that from community to community, the needs change. And yet we often, you know, in terms of the way in which we deliver services, we think both locally and we think broadly at the provincial level in terms of the solutions that are needed. But of course, the solutions that are needed and the needs in the community can vary quite a bit. Then if you dig a little bit underneath that, health, again, number one reason for contacting us. So just in terms of mental health programs, this was just drawn from our Central East region around mental health calls 2009, 2010. So you can see not a lot of change there. It looks fairly flat, a little bit of an increase in terms of calls. But then if you ask, well, what were those calls about? You actually begin to see that, in fact, there are some stories underneath there that are maybe worth knowing about. So I don't know whether I can put my cursor here, but yeah, you can see the value there, 67, everything under 100, so you're up to 85. But all of a sudden up here, you're at 124 in terms of counseling. So nearly a doubling from just a couple of months earlier in terms of the need for counseling, even though just in terms of mental health calls, that didn't appear. So as you begin to drill down below the surface, what you begin to see is some interesting data beginning to show up in terms of why people are calling and what the changes in need and demand for services and programs are.